Okay, so in this section we cover the lung space, and while we're at it, since we're opening up the appropriate areas, we cover a couple of things in the throat. And so that's the thymus and the thyroid gland, and in particular we focus on this physical issue of negative versus positive breathing. Please pay attention to that. We like to hit you hard with that. Okay, so this is the general layout. When we're talking about the respiratory system, we're talking about a series of cavities, and then the muscles that help push air through them. So I don't need to belabor, everything's labeled here, but you're going to come in through the sinuses or through the mouth, down through the pharynx, down through the larynx, which is the same as your voice box, your vocal folds, and your Adam's apple. Contrary to popular belief, women do have an Adam's apple. It's just not enlarged by the extra doses of testosterone that men have during adolescence. We'll then get down into the trachea, which is the main windpipe. And we'll talk in particular about the cartilage lining that using the models. And I don't know if there's a special slide for it in here, but we'll get to it. Then it's just a matter of naming the different branches that come off of that. The bronchi, singular is bronchus, goes one in each direction. That gets finer and finer into bronchioli, and eventually down onto the kind of functional unit, which is the little air sacs called alveoli. We got this in lecture already, or half of us have and half of us haven't? Everybody seems pretty positive on this. Okay, sweet. Then I can speed up, right? Below that we got a muscle that's really driving the bulk of the breathing, so the diaphragm. Most of us have already dissected that away, but hopefully we can take a second look at it. Also do notice that there's a series of other muscles involved in getting the ribs to stretch out, including called the intercostal muscles, help separate the ribs. Notice also that the bone part of the rib actually stops on the outside, and the inside has cartilage marked in blue here that helps create flexibility for this frequently moving structure, and those are connected to the sternum. Okay, again, we talked about the the branches already. I won't belabor it. Down here in the functional unit of the alveoli, alveolus, I guess is the singular, what you're talking about is air-filled sacs closely embedded with the vasculature. So it's all, gas exchange is the name of the game. In fact, this structure looks a lot like the kidney, except there the point is to exchange water and ions. So try to note that similarity when we come to it. I think there's a better slide. The next one. Yeah. So when you think about this on just a few cell levels thick level, you're talking about an epithelium that actually lines and protects the surface. That has to secrete surfactants. We talked about this a little bit with cystic fibrosis. We have one of those go a little bit bonkers. You have just a thin basal membrane in between, and then the endothelium, which is a specialized epithelium inside of the blood vessels. Only when it's inside the blood vessels do we call it endothelium. Okay, special term, special purpose. Then we get to the actual connective tissue, which is the red blood cells, and their extracellular matrix, which is the plasma. So all you have really separating these two epithelia, just a little bit of extracellular matrix, and that allows this gas exchange to happen.
One final thing about the trachea, know that it's surrounded by rings of cartilage that are not quite rings. They're actually C-shaped pieces of cartilage where the open end is toward the back, that is toward the dorsal side of the trachea. And the reason that is, think of what's actually directly dorsal to the trachea, that's the esophagus. And the esophagus needs to pass lumps of food through it, so it needs flexibility on both sides of the tube to be able to get the food down. Therefore, there's a flexible side that doesn't have that ring surface on it on the trachea.
When we open it up, I think most of us have already seen this, but today we'll cut away the ribs. That'll give us our better view. The lungs look a lot like a liver, and Honestly, there's not too much to point out there, although this dissection isn't bad for the front stuff too. Yeah, eventually we're going to cut away enough of the fascia and the thyroid and thymus in front of these structures so we'll be able to see the actual trachea going down. The larynx is the bulging out. Again, that's where the vocal folds are. You can see the esophagus is actually dorsal to the trachea, so you'll have to pull that out in order to be able to see it. And we should always remember to look at the diaphragm. That's what's going to expand to give us our negative pressure. And here's the things that are tricky once we're actually inside. The thymus and the thyroid. Two very different structures, both developing out of the head endoderm. The thyroid is endocrine, so it's regulating hormones and stuff like that, signaling throughout the body. The thymus is actually a training ground for your immune system. It's this tissue that sops up any of the antibodies that are produced that would otherwise attack the rest of your body. So it's actually a very important structure for your immune system. It tends to be very big here in the youth and tends to shrink as you get older. And this may actually project down into the chest cavity. So that's okay. So negative pressure breathing. We're going to contrast this with positive pressure breathing. Negative pressure breathing means that your diaphragm expands and it essentially creates momentarily a vacuum or a low pressure area inside your chest. So that space, the next to the lungs, if you vacate that by pushing down on your diaphragm, there's negative pressure there. The lungs' natural response is to expand itself to fill that volume. And so that is what forces the air to come down through the trachea and into the lungs. Okay? That's opposed to the frog, who's going to take a big gulp of air and use its muscles to actually push the air down. Okay. And this is just the visual for that. Again, they're going to grab the air, they're going to use their nice throat expansion, and they're going to actually use the muscles in there to create positive pressure on the upper side of their body, push the air back into their lungs. This is just a picture of a frog. I talked about this. This will invoke the molecules for the gas exchange we talked about.